What is the treatment plan for people diagnosed with Huntington's disease anyway? What do we do now, and what are we looking at?
Yeah, I think the current state is best supportive care and symptomatic management. So what we're trying to do is anticipate some of the challenges that will come and proactively, as much as possible, get ahead of some of the symptoms with modulating treatment. So that would be neuropsychiatric and behavioral management with various psychiatric medications, movement disorder medications, and then as we anticipate problems like dysphagia and other things, maybe being ahead of the game in terms of placement of G-tube and nutrition support and those sorts of things. But it's all supportive care in the current environment. Yeah.
But there's a drumbeat out there. Mm-hmm. We're going to get to this in just a second. Do people know? Do potential patients know about what's coming down the pipeline? Because some of it seems to be exciting.
You know, I think that there are patient advocacy groups in the particular disease states, and in this case, Huntington's, who are doing a really good job of educating their communities about what's coming down the pike. And a lot of companies are working directly with the patient community to let them know what's coming down the pike. So even still, there are a lot of people who are not well connected to their patient advocacy organization and don't know what's coming down the pike. We would hope that their primary care physicians and specialists are keeping them in the know, but unfortunately, you have a lot of patients who are not in well-connected communities, who are in the middle of the country, who are not near care centers and centers of excellence, and so those are some challenges for our patients.
Are there patients out there who tough it out and don't even come, and they don't seek help until it's much later?
I'd imagine so. I can't speak to Huntington's in particular, but I do know with many disease states that there are so many tough people with rare diseases who go through so many challenges. And so, yes, we see it all across the board.
Is there support? Is there education out there for people?
Sure. You know, NORD has educational resources that we offer patients, caregivers, medical professionals as well. And then, as I mentioned earlier, many of the patient advocacy organizations that serve these particular communities are wonderful resources and have great information. They have patient family conferences. They have centers of excellence as well that they can refer people to. Many of them offer information services resources, so if you call, someone will answer the phone and answer your questions. Many of the patient advocacy organizations, they're very committed to serving the patient population, and so you know, and in addition, NORD does too. So you know, I hope that the patients in the Huntington's community feel like they have the support not only from NORD but from other organizations out there.
Just to add, I think for a condition for which there's really no disease modification, I think this is very exciting. I think in crafting what we call prior authorization, we usually work with thought leaders to really try to understand the disease. Mm-hmm. At what point in somebody's journey, if you will, of the disease is this most appropriate? If there's biomarkers specific to how the drug was studied, that certainly becomes part of it. But I think in the end, we want to see better outcomes.